Good afternoon, dear all. Myself, Dr. Rucha Kaushik. I am consultant breast surgeon at Hinduja Hospital. Hinduja Hospital is a tertiary cancer care center, and October being Breast Cancer Awareness Month, we are taking this opportunity to spread awareness among people, and our aim is to create awareness about breast cancer and to remove fear, anxiety, apprehension related with word breast cancer. So, if you have any query regarding breast health, breast cancer, you please feel free to ask and I will be happy to answer them. We have already received many queries, so we will be going one by one. There is a query from Rajvi Patel. Doctor, how common is this? So we are still lucky to have not have that high incidence as West. Though it is a commonest cancer among women, ICMR estimated that 1.5 lakh new cases to be diagnosed in 2016. So one needs to be aware about it. Second query we have received from Saroj Sharma. When do I need to take treatment? So if you find any lump in your breast, you must visit your expert doctor to get yourself checked. And one may need sonography or mammography depending on your clinical finding and index of suspicion. Doctor may advise you biopsy or may advise to come for regular clinical follow-up if there is no index of suspicion. Third question is asked by Pooja Gupta. Doctor, I have strong family history, so what are the chances of me getting the cancer? So about 5 to 10% of breast cancers are hereditary. So it all depends on how many members of the family are affected with the breast cancer and at what age they had the disease and what was the nature of the disease. So you must visit expert doctor, get yourself checked. If required, genetic counseling can be done. But yearly regular checkup is must for you. Fourth question we have received from Sudha Kumar. What are the symptoms of breast cancer? So the commonest symptom is painless lump in the breast, may be associated with some superficial skin changes or there can be associated lump in the armpit, and in advanced cases the overlying skin over the tumor is usually affected. There is a edema or there is skin thickening, recent onset nipple retraction. Sometimes there is a bloodstained nipple discharge from the nipple. So anything which is abnormal or which you feel that it is not normal for my breast, you should get yourself checked. The next query is by Madhura Rasalkar. How to detect it early? So yes, early detection is the best way. If when you feel that there is something abnormal in your breast which is not a normal, premenstrual changes, sometimes you feel tenderness, lumpy breast, which is absolutely normal, routinely happening during your monthly cycle. But if you feel that there is something abnormal lump which is recent onset, not related with your menstrual cycle, you must go and visit your doctor. You can check yourself monthly, maybe on the 6th or 7th day of your menstrual cycle, and you can check both breast, both armpit, maybe how to check yourself, that is a breast self-examination. You can learn from your expert doctor or expert nursing staff, and monthly examination can be done very well at home. Next question is by Sonali Kapoor. Modified radical mastectomy has been done for my mother for her left breast. Surgery done on 1st September. She is 66-year-old and size of the lump is 1.5. It was in first stage when it was detected. Does she need to go for chemotherapy? And hormone therapy has also been recommended because she is estrogen receptor positive. So Sonali, I think if your mom is node negative and it's a small tumor and low grade tumor, we can very well get away with chemotherapy. And usually all these low grade tumors are strong hormone receptor positive. So hormone therapy should be the best option for your mom. And the next question is asked by Niranjana Cheda. So what are the precautions to be taken for breast cancer? So actually there are modifiable risk factors for breast cancer which if we modify them, then we may reduce the risk of having breast cancer. One is having kids before the age of 30. Having more than one kid is a better option. Multiple pregnancies always reduces the risk of having breast cancer. Breastfeeding minimum for a year also gives you some protection against breast cancer. Try to not gain weight because obesity also increases the risk for breast cancer. And stress and diet, maybe if you can reduce and control, then that will help you in preventing it further. Anju Rohra has asked about, okay, she has just requested us to bring proper medical facilities in our small city and honest doctors so that life due to ignorance can be saved and saved from cancer. Anjuji will try to help you out and how it works and will get back to you. But if you have any queries or if you want, we can always help you by video chat or live chat, or you can mail us your queries at our address. Shivani Yadav has asked how to protect our breast from breast cancer. I think that is covered in previous question. कविता चौधरी, कैसे पता चलेगा कि कैंसर की शुरुआत हो रही है और क्या क्या प्रॉब्लम्स होती है? सो कविता जी, हमने डिस्कस किया कि क्या सिम्टम्स हो सकते हैं. सो आपको अचानक से कुछ नए चेंजेस आपके नॉर्मल ब्रेस्ट फील के अलावा कुछ नई गांठ या निपल में कुछ चेंजेस या निपल अंदर खींच जाना या निपल में से रक्तस्राव होना या बगल में नई गांठ आना या ब्रेस्ट में गांठ आना जो which is not normal for your breast. So you should be aware about all those. और अगर ऐसे कुछ नए symptoms आपको दिखते हैं तो आपने एक्सपर्ट डॉक्टर को दिखा के उनकी सलाह लेनी चाहिए. Then Shama Prasad asks, do you have pain regularly in breast? Yes, this is very normal, which is called as a mastalgia, and you can have pain premenstrually, like before your menstrual cycle. A week prior, you can have pain and heaviness, tenderness in your breast, which is absolutely normal. Smruti Khanna has asked, should I stop smoking before I have surgery, and how will this help? So actually, Smriti, you should stop smoking forever. That's what I will suggest you, because it's just stopping smoking prior to surgery and then restarting again won't help you in long term, as smoking is also considered as a high risk factor for all types of cancer. Reema Mehtaji has asked, Doctor, what is mammogram? So, mammogram is a radiological investigation which is done to detect any lump in the breast and to confirm whether it's a cancerous lump, suspicious lump, or non-cancerous lump. And depending on that imaging, we decide to go ahead with biopsy and further treatment along with clinical finding. So basically, mammogram is a radiological investigation which is usually done with compression, particular compression given to your breast, and two views are taken, craniocaudal and mediolateral, just to see your breast and axilla. Sandhya Yadav has asked, Doctor, what are clinical trials? So, Sandhya, clinical trials are basically research studies that explore whether the medical strategy or treatment or any device or a particular intervention we are doing at the time of surgery or after surgery, before surgery, is safe, effective for humans with particular disease. So it's basically a research study carried out in a tertiary cancer care center. And if your patient is eligible for that study, one must participate in that study, which will help us in long term knowing the further advanced treatment and new information about the treatment side effects and future research. So one more query with Pooja Gupta. I have strong family history. So doctor, what are the chances of me getting, is this covered? I think Pooja Gupta we have covered. Saruj. Okay, so this is Poonam Vyas. Will I need radiation therapy after surgery? So Poonam, it depends on what type of surgery you are undergoing. Nowadays, routinely we do breast conservation surgery. There is no need to remove a whole breast, and we can conserve breast with cosmetically acceptable breast with doing some form of plastic surgery intraoperatively. And when we do conservative surgery, radiation therapy is must. Radiotherapy is to be given. But if we are removing breast for other reasons, like if the disease is involving all four quadrants of the breast, or it is extensive, or if there is a subtle microcalcification throughout the breast which is suspicious, and in view of that we have to remove breast. And if the armpit nodes are negative, and if your tumor size is less than 5 cm and mastectomy is done, then usually there is no need of radiotherapy. But If to begin with, someone is a advanced disease like stage 3B, 3A, where we give chemotherapy in a form of injection to downsize the tumor and then do surgery. So all those advanced breast cancer will require adjuvant radiotherapy after surgery. Samiksha Bhatkar has asked, what should I do to get ready for operation? Okay, so Samiksha, first you need to understand what is the stage of your disease, what surgery is going to be performed. It is if usually stage 1 and stage 2, the breast conservation surgery. If your breast tumor ratio is your breast size and tumor, they are appropriate, breast tumor ratio is okay, surgeon can offer you breast conservation therapy without removing breast. So you need to understand the type of surgery and the stage of your disease. So actually, in the second part of question, do you have recommendations on how to help me relax before surgery? If you are stage 1 and 2, you should not worry about anything because it's completely curable as it is diagnosed in early stage, and you know that early breast cancer is completely curable, so you should be relaxed all the time. Purva Mirashi, when do I need to make decision about surgery? So Purva's question is similar to Samiksha because there are 4 stages of cancer: stage 1, 2, 3 and 4. In stage 1 and 2 breast cancer, we can offer patient curative treatment. In stage 3 and 4, we offer treatment to control the disease. So when there is a curative treatment, then there are multiple options of treatment like surgery followed by chemotherapy, followed by radiotherapy, followed by hormone therapy. Depending on your tumor biology and aggressiveness, your treatment will be planned accordingly. So if you are stage 1 and 2 and if your doctor is advising surgery and if you are a suitable candidate for conservation, one must go for surgery. Drishti Tiwari has asked, will I have stitches, staples or bandages on my breast? So Drishti, nowadays when we perform surgery, we try to do conservation if it is clinically and mammographically feasible, and we usually give sutures which are absorbable and they are within the wound. So no suture or staple will be seen outside the wound. So everything will be absorbable. So there will be a thin line as a scar, and sutures will be from within, which will get absorbed over a period of time. Rini Makhani has asked, what kind of pain I will be having afterwards? So Rini, I hope you're asking about afterwards is after surgery. So after surgery, there will be slight amount of pain when we do armpit dissection or any surgery, small surgery in armpit. You might have 3-4 days pain in the armpit and at the wound side, but with our routine analgesics and anti-inflammatory, that pain will be taken care and you will be soon can start working within a day or 2. And you can start your routine activity. Reema Yadav has asked, what will my breast look like after surgery? So Reema, it depends on the type of surgery we are doing. If you are a suitable candidate for breast conservation surgery where we don't have to remove your breast, and by removing lump, if we can give you cosmesis. If not, then we can do some minor oncoplastic procedure by rotating the breast tissue, and we can give you your normal looking breast with breast conservation. And if mastectomy is to be done, we can do upfront reconstruction, breast reconstruction in the same sitting, so that one should not wake up with flat chest, and she will have her own exactly similar looking breast after surgery. So, any more questions we have?
Yes.
Rahul Sa, how much will be the cost for surgery? It depends on the hospital, whether it's a general hospital or private hospital. So usually it's approximately 1.5 to 2 lakhs in private setup, and general hospital maybe somewhere around 5 to 10,000. Snehal Patade, okay, she said thanks for inviting her to this chat. And Avantika Sharma, after pregnancy and delivery, how often should checkup be done? Okay, Avantika, if you don't have any breast issues during your pregnancy or lactation, then maybe you can just yearly go and visit your doctor, get your breast examined by an expert, and actually then there is no need of imaging unless doctor advise. Imaging in a form of ultrasonography or mammography, but unless your doctor advises, you should not go for imaging. Sid has asked, my mother is currently undergoing maintenance chemotherapy for a year for a lump found and removed in her left breast. She also underwent session for radiation and full chemo session for a year prior to that. Post radiation, there was a lot of changes in the breast color, hard to touch. My question is, will the breast return to normal consistency and color eventually, and also how often could her checkups be post maintenance chemo? One last question being, should be there food diet restriction? Okay, so Sid, I assume that your mom is taking either Herceptin therapy for a year or so. But post radiotherapy, these changes are pretty common, color change, hardening of the skin, but it goes eventually around 8 to 9 months post treatment, and she needs to get herself checked every 3 to 6 months by operating surgeon. And post radiotherapy, yearly mammogram can be done. As such, there is no restriction for any food or particular diet, but she should not gain weight and should have a healthy diet and active lifestyle. So till we get more questions, we can talk about types of surgery as we discussed. There are two types of surgery for breast cancer. One which is commonly done is a breast conservation surgery, where we take out the lump and address the armpit node, because armpit nodes are the first station. If tumor has to travel to body, it always tries to go to next door, which is armpit lymph node, and then it goes to the rest of the body. So we, while addressing the primary tumor, we address the axillary lymph nodes as well. If the axillary lymph node is negative, we do not do further dissection, we stop there. And there will be two scars on the breast, like one scar for primary lump and one scar, small scar in the armpit. Your doctor might keep a small drain for 4 to 5 days to drain all lymphatic fluid, because axillary lymph node is surrounded by a lot of lymphatics. So when we do dissection in that area, there is a lot of lymphatic fluid secretion, which is called as seroma. So it will drain through that drain. And second day, maybe second or third day of surgery, you can go home. You can do all your routine activities, and that drain will be there for 4 to 5 days. You can eat everything, you can do all your routine activities, you won't be bedridden after surgery, and all things you were doing prior to surgery, you can do all things even after surgery. So we have one more query. Megha Doshi, my mother has been detected with grade 3 breast cancer and she is being asked to do chemo. Can you please let me know what will be the next plan after chemo? So Megha, actually this is little inadequate information for me to guide you on the next plan, but the grade 3 indicates it's a high grade tumor, that's why chemo has been advised. But if it's an advanced disease, to begin with, further radiotherapy after completion of chemo has to be taken, and depending on the surgery, if surgery has been done or not, or if they are giving chemotherapy to downsize the tumor and then do surgery, then following completion of chemo and then radiotherapy, and depending on tumor biology, whether the tumor is sensitive to tablet treatment like hormone treatment, she will be offered 5 to 10 years of hormone therapy as well. So Veena has asked, does any physical activity reduces the risk of breast cancer? Yes, definitely there are more studies which has indicated that active lifestyle and healthy habit, 45 minutes of brisk walk 3 times a week will definitely reduce the risk of having breast cancer in future. So how does diet help to prevent breast cancer? Sujata has asked. So it's not only for breast cancer, but for all cancers. If one is eating healthy diet with lot of antioxidants and vitamins, it always helps. Gauri has asked that I have heard that smoking causes breast cancer. Is it true? Yeah, smoking is injurious to health, Gauri, as we know that it is a causative factor main for lung cancer, but nowadays research has found that it is a contributory factor in almost all of the cancers. Atulita has asked, do oral contraceptive expose us to a risk of breast cancer? Yes, Atulita, definitely if oral contraceptive is taken, if you have taken in the past for more than 5 years, you slightly have higher risk of having breast cancer, but the risk goes down as soon as you stop taking oral contraceptives. So, Pariniti has asked, how often should I do self-examination and how frequently should I get checked by doctor? So, Parinita, it depends on the age. If you are in your like early 20s, you can just monthly breast self-examination is sufficient, which you can do on the 6th or 7th day of menstrual cycle. And if you're more than 30 or 35, you can visit breast specialist once in a year, get yourself checked, and monthly breast self examination you can do at home, but once in a month. Pooja has asked, does a family history of breast cancer put me at risk? If so, what are the preventive measures? Pooja, yes, definitely family history will increase your risk of having breast and ovarian cancer, but you need to know how many members in the family and which degree, whether it's a first degree, second degree, third degree relative, and at what age they have diagnosed with what type of cancer, what was the severity of that cancer, and depending on that you can consult your surgeon and get yourself checked, and maybe can take help of genetic counselor as well. So Jewel has asked, how does menstrual and reproductive history affect breast cancer risk? Okay, so estrogen is the commonest hormone behind the etiology of breast cancer. So menstrual history, if you start your menstrual cycle very early, like at the age of 9 to 10, and if your menopause is after 54, your duration to estrogen exposure is longer. So early menarche and late menopause will always puts you at risk of having breast cancer. How does reproductive history also, she has asked. I think that we have covered that one should have a child before 30 and should breastfeed the kid at least for a year, because during pregnancy and lactation breast cells they get mature. If we don't breastfeed, the immature cells they remain throughout your life, and those immature cells can anytime turn into cancerous cells. Smriti, can work stress be the cause of breast cancer? So stress can lead to multiple diseases, and yes, definitely could be the cause of breast cancer as well. So what are the chances of surviving after breast cancer? So breast cancer is immensely curable if it is diagnosed in stage 1 and 2. So the chances of cure are almost 90 to 100% if you take proper treatment. So one should not fear of breast cancer. So one should be aware about it, should know what all things to be done, and should visit the doctor at right stage. Any further questions we have? Okay, so Cherry has asked that usually at what age it is most seen in women. So it's okay. So Cherry, it is usually in post-menopausal age. More than 50, once you cross 50, your risk increases. But nowadays, recently, we are seeing breast cancer a decade earlier, 40 to 50 age group as well. We are seeing many cases. But the commonest age is postmenopausal elderly ladies. What are the measures we can take to avoid its effect? Okay, what are the measures we can take to avoid it? So as we discussed earlier that you need to maintain your weight, try to complete your family before 30, try to breastfeed your baby, not to gain weight, have healthy lifestyle, exercise, no for straight no for junk food, eat healthy and stay healthy. At what I think that question is same. At what age usually breast cancer is more? Okay, so we have already answered that. So I hope this has helped all of you to understand the important aspects of breast cancer, and we really thank you for your response. And if you have any queries further about breast cancer, you can reach out us at Dr_Rucha.Kaushik. It's Dr_Rucha.Kaushik at hindujahospital.com.